The Omicron wave swept countries all across the world, sending people back into a life with curbs and restrictions. The highly transmissible variant pushed daily COVID cases to record highs in several countries. While there are several questions that still remain unanswered about the Omicron variant and coronavirus, there are growing concerns on whether or not you could catch the virus multiple times. In the UK, reports of COVID reinfection are growing. People are testing positive just weeks apart in December and January, or having had the virus 3 or even 4 times. There have been cases of reinfections among children too. First, what is a reinfection? Reinfection figures tend to refer to the detection of a second or subsequent COVID infection, regardless of the variant involved. Data suggests it is higher in unvaccinated people and potentially in those whose previous infection was more mild, with a lower immune response. So is reinfection easier with some variant? Well, some experts say yes. According to scientists at Imperial College in London, Omicron was considered to have a 4 to 6-fold higher risk of reinfection as compared to Delta. As per data, protection against COVID from previous infection within past 6 months has fallen from about 85% before Omicron was detected to about 27%. According to the latest figures for England from UK's health agency, since the start of the pandemic up to 9th of January this year, there were 425,890 possible reinfections, with 109,936 found in the week ending 9th of January, accounting for almost 11% of all cases that week. Very few possible reinfections are confirmed, as that requires genetic sequencing. Among those who have had COVID twice are the politicians Keir Starmer and Matt Hancock. There have been also reports of people having a COVID infection 3 or even 4 times, some just a few weeks apart. Do Omicron reinfections happen in a shorter space of time? Experts in the UK say yes. According to UK data, in the months of November and December last year, there were nearly 3,000 cases of probable reinfections within 30 to 90 days after the previous infection. Researchers believe reinfections could be milder given the body's prior immune response. Now, according to some experts, viral load in reinfections is lower in primary infections, suggesting that the disease may be less severe. However, severity of a reinfection depends on various factors, including the vaccination status. There have been many who have been infected the second time during the Omicron wave. Well, the longer COVID is with us and more reinfections could possibly be experienced. The U.S. Center for Disease Control has released some important data on COVID-19, and they are hopeful that this report will change the Americans who are against taking vaccine. Data shows that if unvaccinated people above the age of 65 contract the virus, they are 49 times more likely to be hospitalized. This is in comparison to those who have received their vaccines and booster doses. Like in December, when U.S. was overwhelmed with Omicron cases, the unvaccinated adults were hospitalized 17 times more than those who were fully vaccinated. A similar trend was noticed in the unvaccinated group aged between 50 and 64. They are 44 times more likely to be hospitalized. Coming to the third category of unvaccinated people aged 18 and above were 12 times more likely. And unvaccinated adolescents were aged anywhere between 12 to 17 and 9 times more likely to need hospitalization. The CDC also clarified that hospitalizations can mean constant checkups, intensive care units, and even ventilators. Experts say that it is becoming increasingly clear that a booster dose is needed to extend vaccine protection. Now, the question is, till when will people have to take a COVID booster jab? To these medical experts say that multiple booster doses at short intervals is not a sustainable approach. In fact, there needs to be a type of vaccine that can work against COVID in the long term.
What I'm hoping that we will have it is a vaccine that we will have to do once a year, like we do for many other things. We are looking to see if we can create a vaccine that covers Omicron and doesn't forget the other variants, and that could be a solution, unless if something completely different comes out.
Now, according to the US's top medical advisor, Anthony Fauci, there were 5 stages of the pandemic. And in terms of COVID, the world is still currently in the first phase. The following 4 phases are deceleration, control, elimination, and eradication. WION is now available in your country. Download the app now and get all the news on the move.